Hey guys, it's Tamara, back with another video for you. We're going to continue our discussion on delusions. So I figured that what we would do in this video is we will go over the final delusions, and then we're going to pick back up on Monday, and we're going to talk about hallucinations. So let's just go ahead and jump in. The benefits for you today in this video is that you're going to learn of the final listing of delusions that I have for you. We're going to wrap up this topic, and then we're going to jump into hallucinations. And then on Wednesday and Friday of next week, we're going to talk about some other things. All right, so let's just jump in. So I have my list here, as I always do. And I want to start off with two syndromes that you are probably aware of, but I want to bring those up and bring them into the discussion. So let's start with traumatic bonding or Stockholm syndrome. We all know what that is, right? Traumatic bonding is the whole idea that you've been abused and traumatized by someone close to you. And what has happened is, because of the intersection between happy times and bad times, so you have this interchanging emotional experience with this person, the abusive person. One moment they're happy, nice, and loving. The next minute they're mean and just awful people. Because of that intersection of nice and cruel, those interchanging behaviors in the person, over time, you begin to trust and then mistrust, trust and then mistrust, love and then totally hate. And it puts you in this bind, and it's called traumatic bonding. You begin to develop this emotional and psychological bond to your abuser, and you develop such a strong bond that it's difficult for you to step back and allow that person to be punished, disciplined. You don't want to report them. You don't want to, tell anyone about what they're doing to you. You really do, in a sense, develop a protective kind of mindset over the individual who has abused you and traumatized you. It really is interesting. Stockholm syndrome is the same thing. Stockholm syndrome basically is something that occurs more so in kidnap cases where children, for example, they might stand up for the person who kidnapped them, or they may say things like, I love that person, don't put them in jail. It really is for lack of a clinical term, better term, a backwards way of viewing somebody who has hurt you. All right, so we're all familiar with that. Can those two things, Stockholm syndrome and traumatic bonding, be delusional? Not quite, but in a sense, there is an element of abnormal thinking, just because they don't want the person who harmed them to be caught, to be hurt, to be disrespected, to be unloved. It really is a skewed perception based on an emotional and psychological bond that really should never have happened. Okay, so those two, we're very familiar with those. The next two would be Munchausen syndrome and Munchausen syndrome by proxy, and Munchausen syndrome period. So I'm going to put those somewhere. I'm going to put those here. Munchausen syndrome or Munchausen syndrome, I can never say it, by proxy, or just Munchausen syndrome or Munchausen syndrome. I really need to learn how to pronounce that. I really do. Okay, let's start with Munchausen syndrome. All right, the idea behind that is a caretaker, a guardian, a parent, a foster parent, an adoptive parent, poisons a child or harms themselves in a sense to get attention. So let's start with Munchausen syndrome. Munchausen syndrome is harming oneself for the emotional and psychological benefit of attention, or to receive some kind of emotional, what's the word I'm looking for? I have so many competing things in my head right now, so I apologize. But it's done to get the emotional and psychological confirmation that they desire. So let's say, for example, I diagnose you with Munchausen syndrome. You are a 19-year-old female who has been abused. You've experienced traumatic bonding, and your mother and father were both highly abusive to you. You never felt valued. You never felt loved. You have low self-esteem. You fear the outside world. And in a sense, you're narcissistic because you want everything to be about you, and yet you have low self-esteem. You can't see yourself at a higher level in life. You've given up completely. All right, so let's say you take some pills, and you know that if you take a certain amount of pills, it's going to make you sick. It's going to make you vomit. It's going to cause you to lose consciousness. You do that so that you can be rushed to the hospital, so that the nurses and the doctors will tend to you. While you're in the hospital, you might begin to play around with your IV. You might begin to cause yourself some breathing difficulty. You might begin to say that you can't walk, or that something hurts you so bad that you can't walk, or you can't move, or you're immobile. You ask for a wheelchair, and you exaggerate and sometimes create from nothing symptoms so that you can be taken care of, so that you can receive sympathy and empathy. Munchausen syndrome by proxy is the idea that you harm somebody that you are taking care of, a child, a foster child, adopted child, whatever, and you go to take care of them, but you do it for the benefit of yourself. And so what you do is you might poison that child, you may put things in their IV, you may cause them to vomit or be sick or lose consciousness, you may cause them injury so that you can take them to the hospital and then get the admiration and compassion and empathy from the hospital staff. Now, this is not a psychiatric disorder. This is more of a legal issue because it's malpractice. Not malpractice. Oh my goodness. It's been a long day. I apologize. Not malpractice. It's maltreatment. That's the word I'm looking for. It's maltreatment, not malpractice, maltreatment. And that's abuse and that's neglect. And so there's legal charges that happen because of that. And so it's not a psychiatric condition that we can treat. Now, we can treat depression, we can treat anxiety, we can treat any psychotic disorder that person may have, which may have caused them to engage in these behaviors. But Munchausen syndrome and Munchausen syndrome by proxy is a legal issue. You can get in a lot of trouble. You can also get in a lot of trouble for misusing doctors and other healthcare providers that are providing a service to the community. So, it's more of a legal issue. It's more of a maltreatment issue when it comes to kids and families. It is not a psychiatric condition. Psychology used to recognize it as an issue, but we have never been able to treat it, medicate it, counsel it, nothing like that. We focus more on depression, anxiety, psychosis, and then we leave the Munchausen syndrome and the Munchausen syndrome by proxy up to law enforcement. They tackle that, all right? The next thing, guys, is called COTARD syndrome. COTARD syndrome. That's the belief that you are walking through reality and you're walking through life, but you're already dead, that you're actually dead and you are experiencing the consequences of your death. So for example, let's say you're 55 years of age, you have a nihilistic view and perception of life and things. You've always been pretty negative and pessimistic. One day you go to bed, you wake up the next day and you say, okay, I'm dead. I know I'm dead because everything looks weird. You may be experiencing some of that Alice in Wonderland syndrome. Everything kind of looks distorted and strange to you. And so you develop this delusional belief that you're actually dead, that you're not alive. And so everybody that you see that day and everybody that you talk to is a part of your death. This is a world that I'm living in now that I'm deceased. And so it's that firm belief held to be true despite evidence to the contrary that you are actually dead. You are not. You're breathing, you're living, you're eating, you're doing everything like a normal alive person would do. But in your mind and in your heart, you are dead. All right? COTARD syndrome. The next one, and I'm not quite sure how to pronounce this. I gotta get better at this, guys. Is FREGOLL syndrome, and that's FREGOLL. And the whole idea behind this, and this is our final delusion, the whole idea behind this is that you are a different person, okay? So you're a different person than what you say you are, and you begin to change your identity, you begin to change your appearance as a result. All right. So you almost feel like you're not who you say you are. You're a different person. And so your identity is not what is not what most people know you to be. You change how you look, sometimes even your appearance. You change how you behave as well. So, you know, your frame is there, right? Your body is there, but you totally believe that you are not the person you say you are, right? You're a different person, all right? I can talk a little bit more about this if you guys need more clarification. Let me briefly mention schizophrenia. Schizophrenia is a psychotic disorder that we do treat as psychologists. We treat it with medication and counseling. Schizophrenia can have two different psychotic symptoms: delusions, everything we've talked about so far from Wednesday to Friday, and hallucinations. And we're going to talk about hallucinations on Monday. But schizophrenia often includes either both of those things or one of those things. So delusions and hallucinations, or just delusions, or just hallucinations, okay? You'll also see the person deal with a loss of liveliness in their spirit. They may also struggle with rumination, which is like these repetitive, obsessive thoughts about something. They may also have unrealistic fears. They may become catatonic, which is not being able to move their lips and talk, or not being able to move their body. Research has suggested in the past that catatonia has happened in psychiatric hospitals like Mayview, and there's really scary psychiatric hospitals where there was abuse and, like, you know, hidden patients down in the basement. There's research that suggests that catatonia can actually occur where the individual kind of, their body transforms or contorts and it stays that way. So somebody's arm may be like this and then it just stays that way for a very, very long time. They never get tired of doing this. They're like this at all times. It's like they're frozen, okay? So catatonia. You may also get an individual who is suicidal as well. You may also get an individual who has an inability to think and remember things. Their memory may be affected. So schizophrenia is pretty powerful. It's pretty detrimental to a lot of people. 1% of the population struggles from schizophrenia. And it's something that is treatable. Thank God it's treatable with medication and counseling. Those two things together tend to be powerful, and more powerful than just therapy or just medication. So we will talk a little bit more about this as we move along with videos, but just for the purposes of making this video a little bit shorter, that is schizophrenia in a nutshell. All right, guys, thanks so much for being with me today. I encourage you to give this video a thumbs up if it was helpful to you. Post your questions and comments in the comment section below, and I'm going to put in the description box the link to the previous video that I did on this topic to kind of give you two things to watch at the same time. That way you'll be able to keep up with us and kind of stay on track. So I will be back on Monday with a video on hallucinations. We will talk about that. That's important. If you have a topic that you want me to talk about, feel free to post it in the comments section. I'm always open and I'm always looking for topics. So go ahead and let me know what you're thinking. All right, guys, I'll see you soon. I'll see you on Monday. Bye. Have a great weekend.